All right. This is a segment that I think is of interest to a lot of folks that are on the line right now. Exercise for the exercise intolerant, which I love that title. So we are going to hear from Jean Flickinger, who is a physical therapist and certified pediatric clinical specialist who has been evaluating and treating children at the Children's Hospital of Philadelphia for over 23 years. She has also worked in the adult neurological rehabilitation for several years prior to working at CHOP. And she now has, again, the pleasure of consulting with adults along with children at CHOP's Mitochondrial Medicine Frontier program. She is working on various clinical research projects, including outcome measure selection for natural history studies and prep for mitochondrial disease clinical trials and various treatment options. In addition, she has extensive experience in treating children with neuromuscular disorders, including spinal muscular atrophy, Duchenne, Pompe, and other congenital myopathies. As a part of the neuromuscular team, she has participated in clinical research, including natural history studies and clinical trials, as well as teaching about neuromuscular disorders. And in 2016, she joined the metabolism team in the Pompe Clinic, where she selected outcome measures for evaluating and treating children with late onset and infant onset Pompe disease, referred by newborn screening, and has served on the 2020 USMA Pompe Disease Advisory Board for Sanofi Genzyme. So thank you for being here today, Jean. I will let you go ahead and present your screen.
Okay. So, hi, thank you for having me here today. Can everyone hear me okay?
Yep, you sound great.
Okay, great. I'm going to talk today about exercise intolerance. I have no disclosures. I hope to cover these objectives. I hope you'll get a better understanding of why exercise is beneficial, yet also challenging for persons with mitochondrial disease. I'll review the evidence for exercise in mitochondrial disease, and also hopefully you'll learn some general exercise recommendations. You've probably seen similar slides like this already today, but primary mitochondrial diseases are defined as disorders impacting the structure or function of the mitochondria as a result of either nuclear or mitochondrial DNA, which your previous speaker probably got into pretty well there. And there's a resulting electron transport chain defect. It's a multi-system presentation, so it affects a lot of organs that need a lot of energy to perform. We'll primarily focus on the skeletal muscle, since that is the primary area where exercise intolerance comes in. But of course, these other organs can certainly play a role in being able to perform an exercise program. This is the electron transport chain, sometimes called the ETC, or and it's where it's found within the mitochondria along the membrane here, and it's where your body takes the energy from food, takes the electrons from food and transmits it into usable energy that your cells can use. And this whole process is called oxidative phosphorylation, sorry. And sometimes it's referred to as OXPHOS for short. So we'll be talking a little bit about that today. And these are protein complexes, complex 1, 2, 3, there's 5 altogether. And so you may have heard of complex 1 deficiency, and that would be a problem in this area along the chain. And in mitochondrial disease, depending on what gene defect you have, you may have more problems in one of these or the other. So in 2018, my colleague, Dr. Zokipley Cunningham, did a survey of primary mitochondrial disease subjects, 290 of them, and they responded and with they reported their symptoms, and in the top 5 was exercise intolerance. It actually came in number 3, along with muscle weakness, chronic fatigue, gastrointestinal issues, and then also imbalance. So this is definitely an area that affects a lot of you. So in 2018, I think I got a sense of what symptoms you may be experiencing. 4 a.m., my husband woke me up and convinced me to sign up for this trail race challenge. It's a 25K, and I think I experienced a lot of your symptoms doing this race. Over 4,000 foot of elevation. The first hill, aptly called Humble Hill, starts at this water level here. And when I started this climb, I came extremely short of breath. I had to stop every 10 to 20 feet to catch my breath. And then this middle section here, there were lots of rivers, river crossings, rocks, roots. And as my muscles got tired, I started tripping over rocks. And again, shortness of breath continued with every climb. By the time I approached this last hill, they called it SOB. Now in our medical field, that stands for shortness of breath, but I don't think that's what they meant here. But it was a challenging climb. I was climbing up on hands and feet. By the time I got to this nice flat section at the top, I was not able to run. Most of the experienced runners just, they pick up, climbs over, they start running again. I could not, I tried several times. I could not get my body to even run. And then of course, for several days later, I experienced extreme muscle soreness. So I don't know if any of those symptoms sound familiar to you, but I do hear a lot of those symptoms from my patients. So some of the symptoms listed here include some of what I mentioned. There's an inability with exercise intolerance to complete functional activities. You're restricted by tiredness, winded, muscle cramps, extreme feeling out of breath called dyspnea. It limits your physical activity. I hear a lot, I need to stop halfway going up the stairs and take a break. I also hear a lot, I can do that, but if I do it, I'm going to pay later. So these are some common symptoms. It can be improved by rest. It fluctuates, and I think because it fluctuates, it's difficult for a lot of people to understand your symptoms and why you can do things one day but not the next day. So it can be a frustrating thing, I think, as well. And it certainly gets worse when you're feeling tired. And so how can exercise help me when I feel like this, just trying to get through my normal day? We're going to start with just kind of going over my PT assessment. It's really important to be able to objectively measure exercise intolerance. And these are some of the other things I look at in my exam. I look at strength, and I use a myometer so I can tell exactly how many pounds you're pushing. And we can tell a little more specifically which muscles are weak according to how old you are. And then also we're primarily going to look at this muscle fatigue, exercise intolerance, but these are some of the testing I do to measure that, and we'll go over those in a little more detail. And I also look at balance and coordination, as well as function. And all of these things can impact starting an exercise program. So PT strength, some of the common weak muscles we found in our group these were the top four. Biceps, and it's the top four in both children and adults. Biceps are your muscles you use to lift. Wrist extensors, used for typing. It can affect your grip strength if your wrist extensors are weak. Writing, often there's fatigue with writing. Hip flexors, so you have trouble with that marching motion, walking up the steps. And then ankle dorsiflexors are those muscles that help you walk and lift your feet up so that you don't trip over your feet. So those are the four most common weak muscles. We look at muscle fatigue and develop this test because I would often hear, I can do that once, but if you keep testing me, I'm not going to be able to continue to do this. And so I look at 6 repetitions in a row. And that first repetition we found, so this in the light blue is elbow flexion, looking at your bicep strength. The first rep tends to be in the normal range for age. And then by the 6th rep, you're well below the normal range. We consider a cutoff of -2 as normal range. And they were significantly different. The first rep, significantly different from the 6th rep. So that's kind of how we look at muscle fatigue in our clinic. And then here's one of our exercise intolerance tests. Some of you may have done. It's the 30-second sit to stand. I've also extended that out to a full minute to really get a sense of longer duration. I have also found that this is a great test to do via telemedicine. Our next test, which is a 6-minute walk test, is not feasible to do over the phone. And so this pandemic has taught us a few things. So this is a nice one that can be done over telemedicine calls. And our group definitely scored significantly lower than the unlikely group. So in our clinic, we looked at 59 patients with mitochondrial myopathy and compared them to a group of those patients who were not confirmed. They had similar symptoms, but they were not confirmed to have mitochondrial myopathy. And here's our 6-minute walk test. And we found that in both child and adults, children with mitomyopathy, they're walking less of a distance than what it's predicted they should go. And then we also look minute to minute at each minute, how far someone can walk. And in the mitomyopathy group, the first minute was significantly different to the 6th minute. So it definitely showed fatigue there. Whereas in the unlikely group, there was no significant difference between the 1st minute and the 6th minute. And this is important, I think, to look at it this way, because some people can walk a decent amount for the total distance. If you just look at that total distance, it might seem that you're doing okay, but really you're not able to keep that pace up. So it definitely can show fatigue, even if you're at a higher level of activity. And then our group walked less than the unlikely group, an average of 425 meters. And then I do not include this in my exam, but it's a really important test for exercise intolerance. And it's the cardiopulmonary exercise testing, where they can actually measure your VO2 max. Tavasalo's group described it, explained it well, that the degree of exercise intolerance in mitochondrial myopathy does correlate with the severity of the impaired muscle oxphos, that oxidative phosphorylation. And it's indicated by a decreased capacity for the muscle oxygen extraction, which is the VO2 max. So it's your body's ability to take that oxygen from the blood, it's really the skeletal muscle's ability to take that oxygen from the blood and be able to use it. And this could also lead to exaggerated circulatory and ventilatory responses. So that shortness of breath, even though you're not doing a lot of activity, is also a result of not being able to extract that oxygen that the body needs. And also this just shows that in a study of 40 myopathy patients with the CPET testing, it was able to quantify on the left here is the myopathy group. And this on the right is the control group. And the myopathy group scored lower. They did less work overall. Their VO2 was much less compared to the control group. And then their ability to extract oxygen was much less than the control group. And then also for our little kiddos, it's a little bit harder to test exercise intolerance in little ones, but we try and do our best to get some objective information. And this is a little one doing the gross motor function measure. It's actually, there's 88 items on this test. So, and typically you can run through them pretty quickly, but I will often see these kids do 1 or 2 items and then they'll lie down on the mat in between. They may be able to jump around if they can, but then while you're scoring, they'll be lying down or sitting down or resting in between items. So that's one way we can kind of see for the kids if they have some exercise intolerance. And of course, based on parent report as well, we can get a sense of what their day is like. So I'll primarily be focusing on these first 2, endurance-based and strength-based exercise programs. But in physical therapy, we cover a lot of these areas. Cardiac rehab, for sure, is another great place to work on getting started on an exercise program, especially if you have specific heart issues. So endurance-based exercise is, it's that longer duration, less intense type of exercise, but you can do it for a longer amount of time. So these are just some examples: bike riding, horseback riding. They've done studies where it actually can raise your heart rate and you can get a decent cardio workout from working on a horse, among other things. There's some other great benefits to horseback riding. Swimming is a great one, dancing. Some of the studies that were done in mitochondrial myopathies support the use of endurance exercises. There's some evidence to suggest that endurance-based training can improve your tolerance to exercise. So subjects noted a decreased RPE, which is rate of perceived exertion. So it doesn't feel as hard as maybe exercising prior to an exercise program. Improved peak capacity for work, improved skeletal muscles' ability to utilize that oxygen extraction we were talking about, and improved quality of life. Some other studies have shown decreases in oxidative stress. And then for sure, if the exercise program is stopped, the benefits, you'll lose the benefits. If you don't use it, you lose it. It's true in this case. In this one study by Tanya Tavasalo's group, they did a program of endurance training, and the groups were together for 14 weeks. They did a cycle training on a stationary bike. And at 14 weeks, they split the 2 groups up. One group continued to exercise, the other group stopped, and that group that stopped lost all the benefits they had gained by exercising. That was a study of 8 patients with large-scale mitochondrial DNA deletions. So, the studies are limited with smaller sample sizes, but there's some good evidence in multiple studies that there are benefits, and it's well tolerated. And then this Siciliano's group, they looked more at oxidative stress and found that, again, they did a cycle ergometry program. I think they had 7 patients in their study, and they used a marker in the blood, marker for oxidative stress, and they found that after an endurance exercise program that their oxidative stress levels were less, I think 13.7% compared to where they were prior to starting the exercise program. I wanted to bring up aquatic therapy because there's a lot of nice benefits. There's certain properties of water that make it a really nice place to work out. There's buoyancy of the water. If you have trouble, and especially if you're non-ambulatory or in a wheelchair, or you have a lot of weakness, this is a great place to work out. The buoyancy of the water helps support you. It takes the weight off your joints. The hydrostatic pressure of the water can provide increased resistance to the rib cage. And when you're breathing, it can provide resistance and also improve your inspiratory muscle strength. Also, it can help improve your circulation. The pressure can help control swelling if you have issues with swelling. I had one adult patient who reported every time she tried to exercise, even just walking, her muscles and legs and arms would swell up significantly. So we recommended aquatic therapy for her. The turbulence and the fluid resistance of the water can help provide some resistance training. So you can actually do a little strength training in the water as well. And there were a couple studies that showed benefits over land therapy with improved respiratory muscle, inspiratory muscle strength, as well as improved respiratory measures in water compared to land-based exercises. And these studies were not done with persons with mitochondrial disease, just general studies. I found this article and thought this might be a really nice way for patients with mitochondrial disease to exercise. I've recommended it here and there. I don't know if anyone's taken me up on the offer yet, but Nordic pole walking. It began in the Scandinavian countries to train for cross-country skiing on the off-season. It's a low-impact exercise. Walking's a great exercise. But Nordic pole walking has some benefits over regular walking. It uses more than 90% of your muscles versus 50% of your muscles with regular walking. You could walk faster once you're trained to be able to use the poles correctly. You can burn more calories. Most studies report an increased energy expenditure of 20 to 25% more. But despite all of this, despite all these benefits, the rate of perceived exertion is rated lower. So it doesn't seem as hard as you're working, as regular walking. Some of the evidence for strengthening resistance exercise in mitochondrial disease. First of all, strengthening and resistance exercise is referring to a higher workload compared to endurance exercise. It's a higher workload or intensity. You're doing shorter duration. and lower reps, less, so you're working out less time than you would for an endurance program. But some of the studies support, say, strength training can improve your strength, and is tolerated and is safe. Exercise-induced mitochondrial gene shifting can occur. So our skeletal muscles contain satellite cells, which are typically dormant, but they have a low or absent levels of the deleted mitochondrial DNA. So this study by by Murphy. This Murphy's group looked at this, and so they looked at whether the satellite cells could be shifted so that they were not dormant with a bout of strength training and resistance training. And after their study, they found this to support their theory. Again, studies are limited by small sample sizes, but there definitely seems to be some good support for strength training. This study here by Mark Tarnopolsky, it's actually a nice review of using exercise in primary mitochondrial cytopathies. We're going to take a little closer look at that, but it's a nice exercise of a lot of the different studies. So if you had one study that you wanted to give to your physical therapist or certainly read yourself, this is a nice one that kind of summarizes a lot. And basically, they reported if there's weakness, this is a simplified version, but of course, if there's weakness, you should lean towards doing more resistance training. If your primary issue is severe exercise intolerance, then you should definitely do endurance training. However, which I thought this was a nice point of the article, starting with your area of strength may help to get you started. So if you're extremely weak, you may consider starting with an endurance program. You may be able to tolerate that better and then eventually build up the ability to start a resistance training. Vice versa, if you had severe exercise intolerance but were fairly strong, you may still want to start with a resistance training or strength training program, because that's going to be an easier way to start, a less stressful way for your body to start, and then gradually build upon that. So I thought that was a nice point, and something to consider if you're having trouble getting started with a program. And the other big point was to start slow and progress very gradually. I hear all the time that patients have gone to see a therapist and it didn't work out. And I think possibly because maybe they were, maybe you started up a program that was too challenging at first and moved too fast for you. So start slow, progress gradually. And these were the general recommendations for a resistance program. You want to start at a lower, like 30 to 40% of 1 rep max. And 1 rep max is just how much you can lift or push, depending on what muscle we're talking about, one time with good form. I usually add that. But you're going to gradually work up to 80% of that 1 rep max. Slow and gradual though. And you want to work up to 3 sets of 8 to 10 reps. But again, maybe you're starting with 1 rep and maybe you can only do, 1 set of maybe 6 reps. So you're starting very slowly and progressing very gradually. For endurance training, you're going to start at low intensity, short duration, with the goal of working up to 3 to 4 times a week at 50 to 70% of your VO2 max. So again, it's helpful to have that testing so you know what your VO2 max is to start with, and go from there. But again, you're not going to be starting at that. And then I also like, since there are benefits and different benefits to both, I sometimes like to alternate days, to 1 day of strengthening, 1 day of endurance. But certainly make sure you have enough rest in between before starting another day of exercise. Some pediatric considerations. Definitely I would go to someone that has a pediatric specialty or specifically a pediatric center. Therapy should be fun, and they should incorporate fun activities into therapy. You could also use adapted sports as an adjunct to try and get some increased exercise. It's just a fun way to do that. And then I often like to recommend, especially now during the pandemic, Cosmic Kids Yoga. She really makes it fun. She tells a fun story and you're acting along with the story, and she really keeps the kids engaged. So I really like that option for kids. Think about the tools that you could use to help you be successful in completing an exercise program. Orthotics can certainly be helpful. This one I love in particular. This is the Kitty Gate, and this is the adult version of a carbon fiber AFO. They're super lightweight. You may not need it during your regular activities, but consider maybe using it to participate in an exercise program. I have some kids that will just wear these to go play soccer. I had an adult try these, and she used to sit around at the campsite every year. Her friends would go camping. When she got these, she was able to join them on the hike. So they could be a nice adjunct to exercising, being able to exercise better using an orthotic. This is an adult with a significant peripheral neuropathy. She's got a severe foot drop, and here she is on the right wearing the orthotics. So you can see she may get tired out. You have to use a lot of extra muscles to compensate so that she doesn't trip over her feet, where when she wears the orthotic, oh, is that one not playing? Well, hopefully you caught it the first time. When she wears the orthotic, she gets a nice heel strike. She doesn't have to work so hard in her proximal muscles to clear her feet, and it keeps her from tripping. And she can walk a lot further when she wears the orthotics. So definitely something to consider there. I would also consider some technology, smart watches, GPS watches that can track your activity. If you like to hike or walk, it'll, there's certain apps will help. The Strava app will help track your distance you've gone. If you like to walk in the same place, you can kind of see how you do and compare over time how you're doing. Because I think it's hard to stay motivated in your exercise program, and a lot of these apps can help keep you motivated to stick with it. And then sometimes it's hard to even know, like you can't even feel when you're making improvements, but you are slowly making improvements, and that's helpful to know to keep you going. Consider use of assistive devices. Maybe your balance is a little bit off and it's hard to get your heart rate up because you can't walk very fast. Maybe using a cane or crutches can help you get a better workout. Walkers, same thing. Maybe you're safer using a walker when you're exercising outside. Also, if you lean on your arms when you're exercising, it can help your accessory muscles. If you have that shortness of breath, if you're leaning on your arms, that helps your accessory muscles help lift your chest and assist your breathing better. So something like that may help. There are lots of other newer devices out there. You can check with your therapist. If you're not able to walk without support, you can consider this Biodex body weight supported treadmill training, where you're in a harness, because maybe you're not safe enough to exercise on a treadmill without support. So this can give you the support to be able to complete an exercise program. They also have some walkers, some home units that you could get. They're unfortunately not covered by insurance and fairly expensive, but there are some options out there. This Alter G is pretty neat. If you have a lot of joint pain, it could be helpful. So basically, you're kind of exercising in a little bubble, and it helps take the effects of gravity away. So, but you can start, with more assistance, and then gradually work towards getting back to full gravity if you can. But again, it provides an opportunity to where muscles don't have to work so hard against gravity, but also be able to get that exercise in that you need. And this bottom one here is pretty high tech, probably harder to find out there, maybe at the bigger rehab hospitals, but it's actually almost like a mechanical assistance to walking. The Bioness Zero G is another nice, it's a pulley system along a track, but basically it's taking some of your body weight away so that you can exercise safely and actually perform exercises with good form. And then you could gradually work on decreasing the support as you get stronger. So that's another nice option out there. These are some nice and fairly inexpensive, some of the pedal ergometers out there. If you're not able to get on and use traditional exercise equipment, you can use, and often the same device you can use for your arms and your legs to pedal, get that endurance exercise in. There's also adapted bikes. If you don't have the balance to use a regular bike, adaptive bikes can be great, a great form of exercise, get you outside. And also for kids, allows you to maybe keep up with your peers, which is really important. Okay, so I want to summarize the general exercise recommendations, make sure we have time for some questions. So always at first, you want to get clearance from a physician, a cardiologist if you're followed by cardiology, to start an exercise program. You can alternate between endurance-based and strength-based exercises. You want to start off slow and gradually, and then gradually increase your intensity and duration. You don't want to exercise when you are ill or have a fever. If you're experiencing muscle pain or cramps, if you fasted for more than 12 hours, for sure. Really, I say no fasting. And certainly you want to be well hydrated. You want to be consistent with your exercise to avoid detraining effects. And you want to find an exercise that you enjoy. It can be challenging at first, but I think the key is really starting slow and then gradually increasing that intensity. This again is that same study I mentioned, which kind of goes over a lot of these general exercise recommendations for mitochondrial disease. So that's a good one. Okay. Hopefully I didn't go through that too quickly. Ready for questions.
All right.
I think we already have some from
Thank you,
earlier in the day.
Yeah, so we have quite a few questions to go through real quick. Let me just throw this up here real quick. Okay, let me begin. If you have myopathy secondary from primary mito disease, LHON, will exercise help?
Yes, absolutely.
Have you had patients with primary mitochondrial myopathy who can go days, weeks, or even seasons and be able to walk a lot, feel great, do it on a pretty regular schedule, and then all of a sudden go days, weeks, even seasons where they have severe emotional or exertional and post-exertional consequences? Have you had anything like that with your patients?
Certainly the fluctuations I hear a lot, where patients will be doing well and in a regular exercise program, and then things change. So, and I'm not sure, it's going to be different for each person, but certainly checking in with a physician to make sure there's not something else going on.
To go that long, is that unusual?
It's a little more unusual to go seasons, I would say.
Yeah. Okay.
Yeah. So I would definitely see your physician, make sure there's not something else playing a role here that could be causing you to have difficulty.
Okay. Which specialist tests for exercise intolerance? How often should this test be conducted?
So it could be I would say the two primary specialists would be the physical therapist, of course, and then also exercise physiology. And sometimes that's through your cardiology department. It depends how the your hospital set up, or the pulmonologist might be the one to refer you. But an exercise physiologist is typically the person that's doing that CPET testing, the cardiopulmonary exercise test, where they actually measure the VO2. And then the physical therapist has other ways to test that.
Okay.
You said how often? I would say on average, probably every 6 months, as far as the PT component.
Okay.
Maybe, I'm not sure how often the cardiopulmonary testing is done, maybe once a year.
Okay.
But certainly, if you feel there's a change in your status, and you want to get retested, you feel like things are getting harder for you, that's probably a good time to ask your doctor if you should get retested.
Okay. And then how do you handle the swing between paresis and dystonia in order to create an exercise or an exercise approach that doesn't exacerbate either?
Sorry, so can you read the first part again?
How do you handle the swing between paresis and dystonia in order to create an exercise approach that doesn't exacerbate either?
That's a tricky one. I guess that's probably one where I'd defer to the physician to see if there's to see if that dystonia, there's a medication possibly that could help control dystonia. And again, maybe slow and gradual would be less of a trigger, at least for the dystonia piece.
What are your thoughts about karate? Do you think that is an exercise that would be tolerated?
Oh, I think so. Yeah, karate. Karate would be really nice because it's you're gonna be working on some strengthening Balance is often an issue as well. So you can really work on balance as well.
Okay.
Yeah, no, I think that's a nice exercise.
This person's looking for some advice or for some suggestions. My daughter is non-ambulatory and had scoliosis surgery. She is very limited in her range of motion. Could you give examples of exercises she can do to strengthen her core?
Yeah. So, and it's hard to
Put you on
give
the spot.
specific exercises. But I almost want to say getting her in the pool would be a nice way for her to exercise. Especially, she's non-ambulatory. If she likes the pool, if she likes water, it's a less stressful type of exercise, and you could certainly work your core strength in that pool environment. But other ways to work core is using some, I don't know, I work on posture a lot using the therapy balls. So
okay. And then how do you know if you're doing the correct amount of exercise for yourself? I tend to overdo and then have several days of recovery.
You don't want to do that. Again, if you're sore 2 days, 1 day, 2 days after, you probably did a little too much. So you want to back off at that point.
All right. If you're unable to get through your basic ADLs without stopping to rest, is that considered exercise endurance? Would your endurance training work?
So yes, if you're having trouble getting through your ADLs, I would consider that as exercise intolerance for sure. And yes, you can certainly get benefits from an endurance training program to help get you through your day. Okay.
And we have another one, and I just want to be mindful of our time. I have exercise intolerance, orthostatic intolerance, neuropathy, and have been in bed for the last year. As I'm trying to get unbedridden, I'm unable to move much because it flares up in neuropathic pain. It is pretty bad, and she's wondering, how do I work on exercising my muscles without angering the neuropathy?
Yeah. Again, I might lean towards aquatic therapy for something like that. Okay. But it sounds like if you've been bedridden, maybe talk to your doctor about a more intensive rehab program, because it's going to be hard to get started on your own without a lot of guidance and help. So I would talk to your doctor about an intensive rehab program.
Do you have any recommendations for those folks who go to physical therapy offices with the fluorescent lighting? So many are affected by that lighting. Is there anything you could recommend with that?
Yeah, I'm just asked if they have a private treatment area where you can work, where they can dim the lights, and hopefully they can comply with that.
Yeah, just ask for some. Yeah.
Or maybe wear sunglasses inside.
Yeah. Okay.
If you're comfortable doing that.
Sure. This person says, my son is 4 and cannot keep up with the kids on the playground. Between climbing equipment, balance, running, he gives up quite easily. Should I push him a bit to keep trying, or let him rest once he feels defeated?
Oh, that's always a tough one. And I think part of that is you can't push him too far. You want him to be safe. You want to encourage him to participate with his friends, but possibly if you can help arrange the activity so that the friends could maybe come over and take a break with your son. It's hard to do, but sometimes if you get a special friend that kind of understands your son's needs, and you talk to their parents, see if they're willing to work with you there, and having the friends participate in something your son can do, and then also, as your son is able, participating with your friend in their activities. Or again, getting adaptive equipment that allows him to keep up with them.
Okay.
And sometimes that may mean a power scooter, you know, to keep up with the friends, you know, riding their bikes, or an adapted bike.
How can you tell normal side effects from your exercise routine to overdoing it?
That's another good question. And certainly you're going to feel it, you know, but if it lasts more than a day, I would say that's probably overdoing it.
Okay. And this person says, why after massage therapy, my muscles feel like the flu for a few days after?
For a few days after.
That's what they say.
Yeah. I think massage is kind of unique to each individual, how you feel, but yeah.
All right. Is it possible for you to share a link where exercise equipment could be obtained for upper body strength? Do you have anything in mind that you could share? Or let me do it this way. If you can you think of something and then email me, and then I can email it in my wrap up to all the attendees?
Sure. Yeah.
That way I don't put you on the spot.
So it's upper extremity.
Yes. Yes. Is there a link for exercise equipment that can be used for upper body strength?
Okay. I can certainly give you the I usually a quick thing. I usually Google pedal ergometer.
Okay.
And that's where you can find a lot of the cycle ergometers that you can put on the table and use for your arms. I think that's a nice option. And it kind of gets a little bit of strengthening as well as endurance, all in the same activity. That one.
All right. Okay. Could the seasons be due with the temperatures that are involved in there? Is there a temperature that you would recommend if you are hypersensitive to the cold that you could exercise in?
Oh, a specific temperature?
Yeah.
I don't know officially, but I would guess around 70.
Yeah.
68, 70, somewhere around there. But I would go with how you feel when you're exercising.
Okay. And this person says, oh, thank you for the great presentation. One thing that they said was, do you have any tips regarding how to handle the immediate acute energy needs, balancing them with the longer term needs during the single exercises? In this particular case, IV fluids are increased prior to exercise to allow for some activity, but not much activity is tolerated.
I'm sorry, could the first part of that question, can you repeat that?
Sure. Do you have any tips regarding how to handle the immediate acute energy needs and balancing them with the longer term needs during the single exercise?
Gotcha. So during a single exercise, there's still acute needs such as IV. Yeah, I guess just taking breaks.
Take some breaks.
Take whatever fluid or.
Okay. Well, thank you so much,
whatever,
Jean.
All
right, my internet or your internet connection is, we have a lull, so I don't know if you can hear me or not. Can you hear me? Okay. Well, we are going to thank you, Jean, for your presentation, if you can hear me.